Mystery of Stuff. A man found this strange lump on his palm, then a scan revealed the true cause of this. A man found this strange lump on his palm, then a scan revealed the true cause of this. From heart palpitations to shaky hands, we all have moments when our bodies move without our control. Still, these sensations tend to pass quickly without raising any alarm bells, except in the case of a 27-year-old man in Canada, who couldn't ignore what was happening. This bulging lump on a man's hand revealed a serious heart infection. It started out as a red patch on a man's palm. But over the next few weeks, the blemish turned into a raised, blue lump that pulsed with his heartbeat. The unusual lump turned out to be an aneurysm, or bulging blood vessel, according to a new report of the man's case, published today, March 21 in the New England Journal of Medicine. More alarmingly, the bulge was a sign of a potentially life-threatening heart infection, one that the man may have contracted from a simple trip to the dentist. When the 27-year-old man went to the emergency room, he told doctors that, in addition to the lump on his hand, he had pain in the upper left side of his abdomen. He also said that, during the prior 6 weeks, he'd had fevers, night sweats and little appetite, and he lost 26 pounds 12 kilograms. For 6 weeks prior to his hospital visit, the man in question had suffered a laundry list of ailments. He had experienced a fever, sweat through the night and felt such a drop in his appetite that he lost 26 pounds. And then, there was the bump on his hand. A spot on his hand hurt and throbbed so much that it drove him to the emergency room. Doctors examined his palm and determined that it and a slew of other symptoms signified that something much worse was going on. An ultrasound of the man's heart revealed that he had an infected mass on his aortic valve, a valve that regulates blood flow from the heart into the body's main artery, called the aorta. Lab tests also revealed that the infection was caused by Streptococcus bacteria, according to the report. Doctors diagnosed the man with bacterial endocarditis, an infection of the inner lining of the heart or heart valves. This happens when bacteria enter the bloodstream and attach to the heart, according to the National Heart, Lung, and Blood Institute (NLB). The lump on his hand formed when the infection spread to his blood and damaged the blood vessel. So how did the bacteria get into the man's bloodstream? His doctors said it's possible that it happened during a recent trip to the dentist. Indeed, activities such as toothbrushing or dental procedures can allow bacteria to enter the bloodstream through the gums, according to the NLB. This is more likely to happen if you have poor oral hygiene, which the man had, according to the report. People are also more likely to develop endocarditis if they have a heart defect, particularly a defect in heart valves, the NLB says. During the heart ultrasound, the man was found to have a condition called a bicuspid aortic valve, in which the aortic valve has only 2 flaps, instead of the typical 3, according to the Cleveland Clinic. This condition develops in the womb before a person is born and affects about 2% of the population, the Cleveland Clinic says. The man was treated with antibiotics, and his fevers and night sweats went away just 2 days after he started the medication. He also needed surgery to replace his aortic valve and to repair the aneurysm in his hand, the report said. From then on, he would have to continue taking antibiotics every time he went to the dentist to prevent any more bacteria from sneaking into his bloodstream. But perhaps the most important lesson to be learned from his story is the fact that symptoms as severe as his always warrant a trip to the doctor's office or the emergency room. That move saved his life.
Mystery of Stuff.